First, I would like to ask both your permission to use this testimonial for educational purpose and on internet.
Absolutely, yes.
Absolutely.
So, tell me about how is your life? What are your symptoms?
Okay. So my symptoms started in 2020 of just weakness. I could tell that I wasn't able to walk fast, and I just felt weakness. And then pretty soon I was starting to have pain.
Okay. Now, 1 to 10, how bad is the pain when it's bad?
Yeah, the pain was bad. The pain was 8,
8.
sometimes 9. And then sometimes I would have a 10, and which would make me cry
Yeah,
because I
yeah.
was just miserable.
Yeah.
Miserable. It hurt to do anything.
Yeah. Well, you have what we call spondylolisthesis in the L3, 4, 4, 5. And practically that segments are unstable. And people who do what I do and people who have back pain themselves, they know how vicious the back pain can
Yeah,
be.
it's a vicious cycle.
Yeah, yeah. And but this pain is in your back and the leg, correct?
Correct, yes.
Okay. Now, tell me, you're coming 5 hours to see us. Is that correct?
Yep, we're about 5 hours away.
Okay. And you had a bad experience but you don't want to go in too much of a details. But you went to another surgeon
I did.
that described how a surgery could help you.
Yeah,
By the way, this is a common problem, and this kind of surgery we call spinal fusion are common surgeries. Tell me, what did you hear?
It was going to be a 12-hour surgery, and I was told that it doesn't take a rocket scientist to figure out how to lose weight, because I am a hefty lady, and it didn't sit well with me.
Yeah.
I pretty much walked out crying.
Yeah.
I felt very defeated.
Yeah. Now, as we talked about, certainly this is a bad experience, and certainly 12-hour surgery, that part, she wasn't lying.
Yeah.
She was, what did she explain to you, or he explained to you, what exact kind of surgery she would be doing?
They were gonna pretty much cut me all the way open, and then they
In
were
the
gonna,
front or back?
in the front.
In the
yes.
front,
and they were
okay.
gonna put like cages
Okay.
in
For
between.
how many levels?
2 to 3 levels.
2 to 3 levels. I think the 2 levels means 2 discs and 3 bones. That's what it is.
Yeah.
Now, how did you find us?
My family practitioner was doing some reading, and she read about your guys' spinal clinic, and she told me, you should try this.
Okay.
So the last couple of years we've been trying to get in insurance stuff, and I'm so thankful that I got to come
Yeah.
and talk with you.
No, but you told me as well you watched lots of my
And
YouTube
I've
videos.
watched, yes, lots of your YouTube videos.
Did they help you?
It did, yes. It made me feel at ease, for sure.
Okay, so
It gave hope.
It gave a lot of hope, for sure, yes.
no, and that is exactly what the purpose of those things are. You told me you walked out, you felt defeated,
Yeah.
that there is no hope, and we have a good track record that we can help people in similar situation. The 2-level fusion for us is not a 12 hours. We just talked about that, what we are going to do. What did you hear? Can you recite? Can you tell me what are we going to do?
It's going to be about an hour and a half maybe surgery.
Yes.
With just a little incision.
Multiple small incision,
Yep,
yes.
So, which makes me feel good. That makes me feel better instead of being cut all the way open.
Yeah.
Remove the disc.
And remove the disc, and you'll put spacers in.
Pra-
Titanium
yes,
spacers, yep.
Practically achieving the
Yeah.
same goal as the open surgery, but with smaller incision and much more efficient. And that's why we talked about that there's still a surgery. But you remember what we talked about, the risks?
Yeah, there's always a few risks, but
Yeah.
the risks are a lot. They're not as much percentage as if I would have got this.
So what do you remember,
Our
how those
surgery.
risks are? Do you
So-
want, I know I'm putting you on the spot.
They were about,
Infection.
infection, yes. Your
1/20th of the
so
open
much
surgery.
higher, about 20 times higher if
The
I
open
would have-
surgery,
yes, the
correct.
open surgery.
0.3% in
Yes.
our surgery, about 3 to 5% in open surgery. Okay.
Surrounding skin, scar tissue.
Well, the scar is barely any scarring there because I don't cut the muscle and the bone.
Good.
I dilate the muscle and they fall back, and virtually if I we go back later. In open surgery, it's all scar. In my surgery, there's barely any scar.
Good.
But still, it's a surgery, right?
Yep, it's still a surgery.
We talked about the risk of, that practically durotomy, or where we nip the skin around the nerves and the spinal cord, which is in open surgery, is recited as about 7.8%. Knock on the wood, after 1,500 cases, we haven't had any. And we talked about the hospital stay, time of the surgery, which are all associated with additional risk. So practically, the reason we are very comfortable doing this surgery, we made it very efficient and lower risk. That's why we can do that. That's why lots of people come from around the country to us. Now, let's talk about the weight loss, because I think that is a lost conversation.
Yeah.
People just hush it. Now, how the question is, it's a rhetorical question, but for you and I, we know that. How does one lose weight when you're in pain and you cannot walk? Well, how would one do that?
I don't know.
Fasting,
Just
possibly.
fasting maybe, and
Yeah,
but I've always been one to want to exercise,
yeah,
because if I am more active, my weight comes off.
yeah.
But when you can't hardly walk.
How do you lose
block,
weight?
Yeah, it's very hard to lose weight. You can't.
Yeah.
You can't lose weight.
Okay, well, and that is a theme among spine surgeons. Our societies recommend not to do elective surgery with BMI above 40 because the surgery itself is so damaging. Risk versus benefit is not really in your favor. So in a way,
Going through the front, yes.
that surgeon did you a favor, because that surgery has not the 5% risk of infection. When you're 12 hours on anesthesia, has 15% risk of infection.
I agree that.
So
It all
in a
worked
way,
out.
that surgeon did you a favor. But I think the part that I have problem with is that, number one, is that blaming it on the patient, saying that you have the problem because your weight is high, whereas we know, as doctors, we should know, vast majority of the problem is genetic, and a small amount is the other things, all the other things. And secondly, because we know the surgery is very risky, instead of being truthful and say, this is a dangerous surgery, I cannot do this surgery for you safely, coming clean, just trying to get out of it, in a way, making sure you don't go back there,
Right.
for whatever reason. Okay, so and I think another thing I think that's well important is that I have heard it a lot. They tell to the patient, go lose 150 pounds and come back. In reality, patient go and cannot do anything. They are bed bound, or they are practically sedentary because they cannot walk. They actually gain 100 pounds, and then they're even in a worse situation. Whereas the surgeon should have known that there are some other ways to deal with that. If they cannot do that, maybe somebody else can deal with that. So these are would be my suggestion. Now we are just starting this process, and I really still invite you to go and listen to people who have gone through this process. And I think certainly no surgery comes free of risk, but I will take care of you.
Thank you.
Okay?
Thank you.
Thank you. Thank you for coming. I appreciate that.